How to make your cycle become regular. Today I'll be explaining what regular cycle is, what irregular cycle is, causes of irregular cycle, and hopeful tips on how to regulate your cycle. If you're new to my channel, I am Dr. Lucy, a general medical doctor, and this is Know Your Health with Dr. Lucy. My channel focuses on pregnancy and general health, so if you're interested in such kind of content, keep watching. Regular cycle length is when you see your period every 21 to 35 days, counting from the very first day that you see your period to the last day before you see your next period. So when your period comes less than 21 days apart or greater than 35 days apart, then you have irregular periods. Usually, people mistake varying cycle length with irregular cycle length. Let me explain. Some women might have a 22-day cycle this month, and the next month they have a 25-day cycle. The following month they have a 23-day cycle, and the next month they have a 26-day cycle. But if you notice, all these cycles still fall between 21 days and 35 days, which is still regular and not irregular. So you might be wondering, why should I track my cycle length? Listen, your cycle length shows you your safe days and your most fertile window so that you know the best time you're likely to get pregnant. So what causes irregular periods? The causes are actually very many, but I'll be discussing some of the most common ones and how to correct them. I'll start with the most common one, PCOS, which is polycystic ovarian syndrome. This is the commonest cause of irregular cycles in women, and it is diagnosed when you have two out of the following three criteria that I'll be mentioning. 1. Little periods or no periods at all. 2. Too much male hormone called androgen in your body that causes excessive hair growth on your body, on your chin, on your face, your lower abdomen, and the entire body. It also causes excessive acne that is difficult to treat. And 3. Multiple tiny cysts located on the edge of your ovaries that can only be seen on an ultrasound scan. The major complication of PCOS is infertility because of the absence of ovulations or very few ovulations. So to make your cycle regular with PCOS, your doctor may place you on combined hormonal contraceptive pills. And these pills will regulate your periods by decreasing the production of male hormone and giving your ovaries the estrogen that it needs in order for your periods to become regular and restore ovulation. Another cause of irregular periods is high prolactin levels. High prolactin levels is a condition where a hormone called prolactin is higher than normal in your body. Prolactin is a hormone that is most known for stimulating milk production in breast, but it is also involved in other functions like ovulation and reproduction. So this hormone called prolactin should only be high when you're pregnant or when you're breastfeeding. So women who have high prolactin levels when they are not pregnant or breastfeeding, they may experience irregular or absent periods, along with other symptoms like abnormal breast discharge. So to return the prolactin levels to normal, your doctor may prescribe a medication called dopamine agonist. Another cause of irregular periods is being underweight. When your body fat is too low, it causes a hormone called leptin to reduce significantly, and then it makes ovulation to stop. This is because the hormone leptin is produced in fat cells. So if you lose too much of fats, the level of the hormone leptin also reduces, and this can lead to irregular periods or absent periods. The treatment for this is weight gain, and you can achieve this by eating a well-balanced diet. Another cause of irregular periods is too much exercise. Even if you have normal weight, too much of exercise can cause irregular periods and stop ovulation. This is because your body needs energy to function properly. When you exercise too much, you end up burning more energy than what you consume in your meals. So the treatment is for you to increase the amount of foods that you eat or to reduce the amount of exercises that you're doing. So there are many other causes of irregular periods that include premature ovarian insufficiency, low ovarian reserve, and thyroid dysfunction. For premature ovarian insufficiency, that is when your ovaries have little or no more eggs before the age of 40. The treatment is using an egg donor or IVF. For women with thyroid dysfunction, sometimes medications can restore ovulation. So you see that it's very important to know the reason for your irregular periods before attempting treatment. You need to see your doctor to get completely evaluated to find out why you are having irregular periods. If you found this video useful and you want more content like this video, share it with your friends, drop a comment in the comment section below. Don't forget to subscribe to my channel, turn on the notification bell so that you do not miss any new upload. See you in my next video. Bye.